We
So
look
anyhow,
forward to his
actually
guidance
I
in
was
the
little
future.
hesitant to lead this, but then when she said, because actually I'm working on with Dr. Arun Singh and Dr. Gangadhar Sundar from Singapore, where we went to, there's a separate Somaya Medical College in Bombay, it's a private, where they had a Asian cancer hospital, where they hired a place in the, like the US, a place in the medical college and did. So I thought, why not we have a separate hospital? Because most of the patients who come from retinoblastoma are poor, somehow in the lower socio-economic status. So I thought private hospitals seeing they will be afraid, plus they can't afford. And we have Akshay Nair as a oculoplastic, as a ocular oncologist and trained in L.V. Prasad. He also said we need multi-specialty, like Dr. Bishwa has mentioned, and she has the radiology, the other, so many things required. So we thought we'll have adjacent to the main cancer hospital, and Bombay has the Tata Cancer Hospital, and so happened Ratan Tata is my good friend, but he is starting 100, I don't know how many years completed, I think Varanasi, and so I know many places where the cancer was not there, he started. So I accepted to Dr. Bhavana that that's why the talk about a need for such a society, Eye Cancer Society of India. Eye cancer is a cancer that forms in the. Many people, patients don't know that eye cancer can happen in the eye. I don't know why. Somehow they think that eye cancer, they'll ask. And eye cancer can occur in the newborn, in children, and in adults. And a lot of things have happened even in genetics, so even intrauterine diagnosis. So that's how I'm also the Global Eye Genetic Consortium Secretary General, along with Dr. Takeshi Iwata. People are working on. So I think moving towards from continuing as a surgeon, but in between all this. So the most common cancer that starts in the eye is melanoma the world over, but you heard Dr. Bhavana Chal talking about retinoplasm, which is more common in India. And when I went to Vienna to an ocular oncologist, I mean, that patient, can you believe the OPD? They have 50 melanomas coming in a day, and then follow-ups and new patients. And I mean, it's really, people don't know that melanoma. Fortunately, I think because of pigmentation, Indians are spared. But I remember operating two of the patients, one with a melanoma. I did an internal resection, and with that time we tried stereotactic surgery with the Hinduja hospital, the gamma knife. But anyhow, the patient is surviving because we could treat. And one more, I will call it a mistake. We went away. There was a masquerade syndrome. Child was referred with injury. With the injury was a blunt injury, but patient had endophthalmitis. That was the picture. So when I did a vitrectomy, the child, I have a routine habit of sending it for PCR, for culture and sensitivity, and part of it for histopathology to be sure. It's like it's there all the time. Any tissue, whether it's stroma or endophthalmitis, I do. And suddenly this happened on Saturday, and when I was operating only, I found something like a creamy substance, and I thought it doesn't look like a tumor, and retinoblastoma never came in my mind. But anyway, I had a video recording, and I sent the specimen. Luckily, it reached, and so I don't know why on a Monday morning, Dr. Bishwas opened it and found, and he called me, it's emergency. You call the child back, otherwise the child will die. And I was really scared. And at that time, Dr. Mahesh Shanmugam was doing the PhD in retinoblastoma. So I sent the child, they did a chemotherapy. The child is alive. I keep celebrating with her birthday. And she's referred from BA. So in spite of all the experience, you can miss. So I think it's important to create awareness within the ophthalmologist. That's why I'm happy Bhavana selected a mid-year conference to inaugurate this. And I think every state, this is what I'm telling Teleophthalmic Society. It's not for proper campaign. I think I'm beyond all these recognitions, and I think we should give back to society. Any other place I should have retired by this age, but I don't look that. No, but I decided to do more service, and for the next 35 years. So the cancer is a malignancy that starts and grows in the eye, and which I think all of us sitting here know. Just now Bhavana mentioned this. And so eye cancer is a rare disease, meaning treatment efforts across the world vary, and that access to care is not always readily available. I think that's why I accepted this as a social cause, and I think we have to motivate people to keep them aware, because if you detect early, probably you can save the vision, the eyeball, and the life. And people don't know. And I remember the exam questions when I was an undergraduate as well as a postgraduate in the 80s, that a patient comes with a glass eye and something has been, when the second is in the liver, what will you think? I mean, the melanoma, because I think it was all theory that time, and now we see in the reality. And there are very few foundations in India dealing exclusively with eye tumor. There is one such foundation in Bangalore, which is there's a ICSA Foundation. So that person had a friendship with the chairman of the RBL Bank in Bombay. So they collected 4 crores and gave, and they did a road show. One, I forgot her name now, she's a Rotarian. She, with her husband, does the cycling and collects money from Bombay to Bangalore, and then she collected like that, and so they have given money to this foundation. So similar thing I think we should do, because people are doing, and then we can give to the people who cannot afford to take the treatment, or also for research. So thus there is a need to have an exclusive institute of eye cancer. I'm sure Bhavana should be able to create a separate eye cancer institute within RP Center, which is possible, and that's the homework for you. So you can have a parallel to RP Center. So thanks to Dr. L.P. Agrawal, who could create a parallel AIMS and made a RP Center. I mean, if you see the origin, I think RP Center was equal to AIMS, and now AIMS has become bigger. But a similar thing you can do for, I think Delhi will be the best place to have the institute with a focus on patient care, rehabilitation, education, research, and innovation. And why can't you have worked in Washington, and you worked in US, and you have seen all the clinics. Why can't we create something like a Mayo Clinic in the institute, and which is possible? And I think even our Prime Minister is ready for private partnerships, public-private partnership, which you can collect money from the private also and have the government and have a separate institute. So the main aim of establishing an eye cancer society in India is to develop and encourage national multi-center research on new diagnostic treatment, to provide much needed support services for patients and their family, and to save lives through our fellowship program by training doctors in underserved and unserved areas to treat eye cancer. The mission of the Eye Cancer Society would be to create a world-class resource for patients and their families diagnosed with eye cancer in the form of ocular tumors or melanoma and related ophthalmic conditions. The Eye Cancer Society of India will support research efforts that will advance treatment and methods, and overall the rate at which eyes and lives are saved. With research, eye cancer can be probably even prevented and then treated. A fight against eye tumors, ocular melanoma, and other eye cancer diseases. So I thank my team for preparing this. It's a very short presentation. So if you have a cat's eye, don't ignore. And I think in India, even a congenital cataract is neglected, but I'm sure now we are much better off, even in the villages. Where I think through teleophthalmology, if you take a simple photographs like this and send it with the using of AI, I think AI should be able to diagnose whatever we are dealing with. So I think Remedios come out with a software both for anterior segment photograph and posterior segment. I don't have any financial interest, but we can use the same just anterior segment photograph and a fundus photograph, even though it will cover only the disc and around, and that's enough for basic screening. And then later, I think we can peripheral tumors. I think if the patient goes to the advanced center, it can be done. So with this, I hope we will create more interest in ophthalmic oncology. Thank you.